Hi, I'm Karen Strange. I'm here with my dear friend, Frye. She is joining me for my very first podcast. I'm very excited to be doing this. So, welcome, Anne. Thank you for being here and being the first one up.
Well, I'm delighted to be your virgin guest.
Well, cool. I want people to know you, and I've already had people asking, Anne Frye, you're going to be interviewing on a podcast with Anne Frye? Oh, I want to be sure that I'm listening. So I know that it will be, excuse me, I have a little cold, well received. But I thought we'd just sort of start with just a little background, because typically people are just like when we were in Toronto at ICM together, and people were like, is that Anne Frye? They were just all gaga. But my guess is they don't know too much about you. So I thought I'd just start with some basic questions like, where did you grow up? Where are you from?
Well, I grew up in Atlanta, Georgia. Back when I thought Atlanta wasn't a very big town, and now it's a huge town.
For sure. What was your first birth experience?
Well, my own birth was my first birth experience.
Right.
And it was a very disconnected situation. My mother always said that she couldn't be knocked out soon enough in labor. And although she wanted to breastfeed, she was one of the epidemic of women in the 50s who, quote, couldn't breastfeed because of the draconian measures they took to sabotage breastfeeding at that time. And contributory to that was the fact that when I was born, I was so drugged from all the drugs that she'd had that they sort of had to force feed me in the nursery for about 5 days. And of course, a baby like that doesn't have any kind of normal suck. So by the time I came to, I was not interested in nursing. And of course, her milk was totally messed up from the other end of how they take care of women. They typically took care of women at that time.
That sounds like a really miserable experience.
Well, it was, and I think it was a pretty disheartening experience for my mother as well, but it kicked off a lifetime of disconnect between she and I.
For sure. So then, well, my guess is you didn't know that for quite a while. So what was your first birth experience other than you being born?
Well, when I was in San Francisco, I was attending a vocational training program with the Holistic Life University, which opened very shortly after I moved there in probably 1973 or 74. And I was with the Holistic Childbirth Institute, which at that time was a 2-year didactic training program that was eventually supposed to evolve into a clinical training program for midwifery, which it never did because of the legal situation in California at that time. And so I was going to school, and toward the end of my 2-year academic training to become a Holistic Life University childbirth educator through the Holistic Childbirth Institute, I was attending births as a labor support person. And it seems like, I'm not sure if this was the first, but it certainly left a very strong impression on me. I was called to the hospital to provide labor support for a woman who was developmentally delayed. And she was in labor. And of course, I was green as grass. I didn't have any idea really to how to help somebody cope through a challenging labor like this. I hadn't had any clinical exposure. I was just basically learning theory, which was pretty comprehensive at the school, but there's no substitute for, um, you know, in the trenches dealing with laboring women, as I'm sure many of your listeners know. So I got to the hospital, and this woman was wanting more and more drugs, and they were giving her more and more drugs, and they were telling her that those drugs would not hurt her baby.
Mm.
And then they took her into the delivery room finally. And I know they were giving her pain medication. She was not knocked out, but I am not sure whether they were augmenting her with pit or not, Pitocin. They probably were. But she did get to the point of pushing. She was taken into the delivery room. I'm trying to remember whether I was actually allowed to go into the delivery room with her. I think that I was supposed to stand outside, but I was right outside the door. And of course, the baby was born completely like out of it, bathed in meconium. And they took the baby over, and it was quite a small baby, as I recall. And they were working like crazy on that baby. And I was like, oh, you know, this is it. This is exactly textbook about how it goes in the hospital.
Mm-hmm.
And then there were another couple of labor support situations that I was called in to attend in the hospital as a student. And then there was a woman who I got to attend her birth as sort of a observer / support person that was supposed to be a home birth, but it turned out to be, in fact, eventually a transport. She was at home for quite some time.
Mm-hmm.
As I recall, the baby was fine. The baby of the woman who was developmentally delayed did finally come to, although it was quite a dramatic scene at the hospital. And they took that baby right into custody, foster care custody.
Oh.
It was terrible. I can't even remember whether the mother saw the baby.
Oh, this sounds like another incredibly dismal birth.
Yeah.
So is this what kind of drew you?
No, as a child, I played midwife constantly.
Ah, I didn't know that.
Stick babies up people's shirts and deliver the baby. And I didn't really have much sense of the total scope of midwifery care, but, and I'm not even sure that I knew that I was playing midwife, but I don't recall calling myself a doctor. And I did know the word midwife was in my household because my mother, when she was born to my grandmother, had a black midwife there and a white doctor. And that was in 1921 in Waynesboro, Georgia, which is southeast of Atlanta by about 200 miles. So it's a pretty big town in rural Georgia, but it was pretty rural at that time. And certainly in 1921 it was. And so I knew about a midwife. That word was in my childhood vocabulary. So I played midwife a lot as a child. And then when I was 8 or 9 or something, one of my mother's good friends in the neighborhood was pregnant. So I took note of that. And also, way prior to that, I was 2.5 between, right in that area, 2.5 to 3, when my mother was pregnant with my brother, and she took me to the doctor with her, and he would let me listen to the baby. And I'm sure he let me listen with a fetoscope since there were no Dopplers at that time in 1956. And that may have actually been the beginning of my interest, but I don't remember those experiences.
Mm-hmm. The thrill of hearing the baby's heartbeat.
Right.
But you clearly remember that you got to hear.
No, she told me.
Oh.
I did not remember. I did not remember.
Yeah, because 2.5, 3 is about when we start having the words for and still remember our birth. But that's kind of an amazing story. I didn't know this about you, that you played midwife or were a midwife all those years. So The interest in the school, excuse me, the school in San Francisco was just sort of like the next step for you to.
Well, when I was working in San Francisco, I did not go to San Francisco. I just went to San Francisco to go across country. I landed there. I got a job at Rainbow Grocery, which was a cooperative grocery at that time. And one of the other people that was working as a checker there said that she was going to this school and her goal was to be a midwife. And it was like, oh. And then I remembered a dream I had about helping a woman in the fog on the dock, surrounded by people. I have a baby. I don't have there were no anatomical details of that dream, but I do know that's what I was doing. And I remembered that dream, and it was just like a revelation. This is my path.
This is it. Wow. Wow. That's pretty cool. We could certainly go into past lives here, but we're not going to do that on this podcast. That's very cool. So,
well, I will say that I have been told that I have had two guides as a midwife. One is a grand midwife, a very traditional midwife, like grandmother, and another was an old-time home birth doctor.
Wow. And these are your past lives or guides?
No, these are my guides. These are guides that have helped me as a midwife.
As a midwife. So do you want to say something about how long you practice? And then I do want to ask you some questions about how we met and the textbooks, but where did you actually get your midwifery training and how long did you practice? And
well, I got my midwifery training for clinical skills at the maternity center in El Paso, Texas, which at that time existed, and it was run by Sherry Daniels.
Right. And is that the only place you practiced?
That is where I got my clinical training.
Okay.
It was a very intensive 6 months clinical training program.
Yes.
That my eventual midwifery partner used to call the Berlitz of midwifery. It was, we were living there, we were working there, we were living there. It was intense. Immersion midwifery.
Yeah. I had sort of the same experience. And then did you practice outside of El Paso?
Yes, I went after my 6-month training at the maternity center. Myself and 3 other students, one of whom had been an intern at the maternity center, so she'd been there a full year, already supervising incoming first 6-month students. She and 3 of us who were in the same class together, having had 6 months under our belt, opened the Rising Moon Birthplace also in El Paso, and we attended births there for 9 months. Yeah, after that, I went to Atlanta, Georgia, where I joined Rahima Baldwin and her communal family. And Rahima and I practiced for a short period of time in Georgia, in Atlanta. And then she and another member of that group went to Southfield, Michigan to attend the Waldorf teacher training program up there. And then other members of the group followed later, and we all lived together in Detroit, where I practiced for about a year. And then I moved to Syracuse, New York, and joined my sister student, Dev Kiran Khalsa, in her already established practice in Syracuse. And she was preparing to move with her partner to time out there. And we had a woman come to us at 32 weeks gestation who was dramatically anemic. And so there was a little tiny nursing library close enough to Moon City that I could go and do a little, ad hoc research. So I went to the nursing library. Now, admittedly, this was a very small nursing library. It was not state of the art even at that time. But I, pulled a few books off the shelf. I'm looking up anemia. I'm looking in laboratory diagnostic books. Well, anemia, which is a pretty garden variety problem,
Right.
is not discussed in any depth at all. And what it means in pregnancy is barely addressed. And I started looking up other things, and I realized that this was true across the board, that it might say that it increases, it might say that the value should decrease, but it didn't say when, it didn't say why, it didn't say how much, it didn't say what the normal decrease was versus a pathological decrease, nothing. And this was astonishing to me, that there was so little information on something as common and as universal as anemia as a problem. So I came home back to Moon City, and I had a typewriter, of course, there were no computers, and I just started writing. I just started doing the research that I could in the textbooks that I had and trying to piece together the information, which I became increasingly aware was incredibly fragmented. Now, it's still fragmented to a certain extent, but it's not as fragmented now as it was then. It was unbelievably fragmented. And much of what was needed to be known was not written down because people were learning it on the job in their clinical training in hospitals with their doctor preceptors. And we didn't have access to any of that. So I quickly became aware that if I were very passionate about doing this research, that I was not intimidated by going into the medical libraries, that I was willing to plow through the language and learn the vocabulary, that I was probably in the minority. That there were a lot of people called to midwifery that didn't have that kind of aptitude. They were in it for a different reason. Yeah. And so it became more and more evident to me that I needed to share what I know. So that when I got out of school and I got out of the situation where we were establishing the Rising Moon Birthplace and I moved to Atlanta, Rahima at that time was the orchestrator of a childbirth education program for people preparing parents to have home births. And so she provided me very willingly with a vehicle to go out and share what I knew in the form of 5-day midwifery skills workshops. So I called my buddy Val, who was at school too, and we started to put together a 5-day midwifery skills workshop to pack as much information as we could into those 5 days to share it with midwives that did not have the opportunity to go to school. Because when I was accepted into the maternity center, there were literally only 2 or 3 venues for formal training in the United States for direct entry midwives.
Wow.
One was here in Oregon. One was the maternity center, and I think that there was a program in Brownsville, Texas, but really there was hardly anything to offer somebody that wanted a formal program and not just a private apprenticeship. And I would have been delighted to have a private apprenticeship, but I didn't know anybody. I knew Nancy Mills. She was a very well-known midwife at that time, but she had a list. She had a list of 200 people that wanted to apprentice with her. She had the pick of the litter. So, and I also was very acutely aware that Ina May at that time was very clear that she did not feel like somebody that had not had a baby had any business being a midwife. Now, she later changed her mind about that. But at that time, I just felt like I was just spinning my wheels to attempt
Right.
to apply to train there.
Right. Well, there wouldn't have been you, there wouldn't have been me if that would have been true.
That's
So,
right. And a lot of other people.
yeah, exactly. So you went from teaching these 5 days workshops, which I know we've talked just a little bit about in the past, to actually putting together booklets, and then I'm assuming booklets into textbooks.
The booklets and the 5-day workshop, well, the booklets grew out of the writing that I had begun in school.
Got it.
And then the booklets, there was a booklet for just about every day of the workshop, 4 or 5 of them, 3, maybe 4 of them. There was one on lab work, one on suturing, and there was one on complications, one on herbs that Val wrote, and one that was a workbook throughout the time of the 5 days. So there were like 4 or 5 different booklets that you got when you attended the workshop. The 5-day workshop, which I want to mention, cost, wait for it, $125.
Oh my God, Anne. Oh my God. Wow.
Anyway, we were teaching the workshops. We started getting requests for the booklets outside the workshops. So instead of saying, well, you have to attend the workshop in order to get the booklets, we decided to print overruns. We started selling them through Moonflower. And then when we stopped doing the workshops, as educational opportunities became more available, we continued to sell them for a while. And then I started writing, still on a typewriter, mind you,
Right.
a 3rd edition of Lab Work for Midwives is what it was called at the time. And then that was a little yellow edition. Some people may still have a copy of that.
I do.
And after that, I printed 500 copies of that. And I continued. I would get cards and postcards and telephone calls asking where the books were. So I said, I'm not writing anything else until I can afford to get a computer with a hard drive. So that as soon as computers came down to $1,000, I bought myself a computer with a 40 megabyte hard drive. This was a very big deal because at the time people were using floppy drives, which is a flexible disk. For those of you too young to remember what a landline is, you stuck one in one that had your program on one slot, and another that had your program on it, and another in another slot to put your data on, and the storage capacity was very limited. So I had my computer with a hard drive, and I wrote the 4th edition of Lab Work, and then I immediately started on the 5th edition. This was all while I was practicing in New Haven.
Right.
And it's a lot of work to write and practice at the same time.
Yes. Yes, absolutely. So when did you start writing Holistic Midwifery Volume 1?
While I was still in New Haven.
Really?
Yeah.
Did you finish it?
I had gotten about 80 or 90 pages into it. And I was trying to fix something on my computer one day. And I noticed that on the screen that there was the letter F kept repeating. And I kept repeating, and then I said, uh-oh. I was formatting my hard drive. So fortunately, I did have some backups, but that was a bit of a kick in the pants to have to kind of sort of start over.
Anne, do you want to say something about like how we met and how we started talking a little when you were doing putting together Holistic Midwifery Volume 2? I can't even really remember exactly where we met. Maybe you can remember better, other than maybe
I
a conference.
certainly, I think I knew of you
Right,
through your work with Deb Cayley.
right.
Um, and I think I knew of you through my relationship with Diane Holzer.
Ah, okay.
And however, the thing that I remember the most clearly, I knew that you were teaching resuscitation, and we must have crossed paths
Right.
in some peripheral way. And then I remember doing the nitty gritty research on intact, the physiology of leaving the cord intact. And I think that I had heard you speak somewhere and that you had addressed it. And I remember calling you up, somehow contacting you and saying, Karen, this is like a really big deal. We gotta really get this and emphasize this a whole lot more. And you were very receptive. You were incredibly receptive, and to learning more. And we are where we are today, with understanding that it is absolutely pivotal to normal transition.
Totally. Now, actually, it's funny because I remember you were telling me, however it is we contacted each other back then, that you were writing this section on resuscitation of the newborn, and would I read it and give you some feedback from the classes that I was teaching? And
yeah, well, that's certainly possible. Yeah, yeah, right.
And that to me, when you shared your manuscript, it was just jaw-dropping, eye-opening about the evidence-based studies behind resuscitation, which may or may not have been reflected well in the NRP textbook. And I remember that just being like, oh my God, there's so much more to this than what's in the textbook. And then you talking about ILCOR, the International Liaison Committee on Resuscitation, and how between books they release guidelines, and each country kind of does their own thing. And I remember you telling me you were reviewing the UK Resuscitation Manual, and how that book really, that book transformed how I taught, how I thought, on every level. And I just remember that was sort of like the beginning of our budding relationship, because I can totally remember the house I was sitting in where we were going through different chapters in your book, and especially the cardinal movements. And, it was just kind of like we almost had the same sense of humor. And I don't know, it was an inspiring, stimulating, exciting time, even though I was in Dallas at the time and you were in Portland, just reading through and dialoguing with someone that, midwives, we love to talk about births, for sure. So I am like, that is like so imprinted in my head. And that actually really amped up my passion on how to teach neonatal resuscitation in the least traumatic way. And you opened that door for me. So
well, that's great. I do remember all that now, but I didn't remember when it occurred
right.
in the sequence of events. But maybe that's how we established our relationship, and then we started talking about the intact cord probably right around that time as well.
Yeah, and then you're the one that actually turned me on to Judy Mercer and said, Judy's got this whole presentation and she's very nice. I'm sure she would share it with you. And I was like, oh my God, Judy Mercer? Okay. And she was just like, oh my God, just the doors opened, and then just more, dialoguing back and forth, you and I, her, and then plugging into sort of the whole cord clamping group within the world. So yeah, that certainly became the beginning. So I guess my my next question is kind of what is your favorite birth topic to talk about and to write about?
Well, I really love the really, getting into the nitty gritty of what some might consider the really boring stuff. Like I've been writing for months about updating the stuff about the pelvis, because I think that the pelvis is a pretty important part of the anatomy for midwives to have an intimate understanding of. When you're reaching in there blind, trying to figure out what's going on with fetal descent and stuff like that. How am I going to understand what Gail Tully, for example, is teaching about how muscle and ligament tensions and asymmetries affect the pelvis, affect fetal position, affect fetal descent, and all that, how maternal position and activity in labor affects all those things. So I'm emphasizing it in more detail than anybody else. And I also love sort of like reinstating the fundamentals of midwifery in my textbooks. Like my section on fetal descent in volume 2 of Holistic Midwifery is something like 258 pages.
Right.
And I dragged up concepts and principles and details about fetal descent, language, vocabulary that has fallen out of the textbooks because we give such short shrift to the basics. And I really feel like I'm doing what I can to help preserve those things, because birth is more than the baby falling out or cutting it out. And so I feel very gratified that people have received my work so generously. I feel like it's been great that people find my work so valuable, because I really feel like I'm trying to make whole a very fragmented knowledge base.
Yes, absolutely. And I personally, I just wish your book was in every midwifery school worldwide, and not only in every midwifery school, in medical schools. I sent it to my friend Dr. David Hutchins in the UK, and he was just like, "Oh my God, this is so comprehensive. Oh my God." Just even that they're looking at it, the female anatomy as opposed to male anatomy, and it being a little bit different. So yeah, thank you. And I can see why people are so in awe of you, and those that have actually read your book, have actually opened your book and used your book to know the wealth of drive that you bring to it. Not just all the studies and all of that, but just that piece, that passionate piece of bringing the whole to this fragmented topic. So if
I must say that you've made an enormous contribution too, Karen, with your very holistic grasp of neonatal transition, and also what the baby needs when it needs help.
I just want to put a little plug in for the overlap that you and I have over the baby's experience of birth and the Association for Pre and Perinatal Psychology and Health, which is the website, birthpsychology.com, if anybody is interested in understanding a little bit more about how babies develop in utero, emotionally, psychologically, how their personalities are formed, that all really begins, well, Bruce Lipton would say before conception, but if you don't want to go that far, you could just go from conception on. And I would even add the earlier, the experience, the earlier in your prenatal period, the deeper the imprint. There's sort of this belief that until you can feel the baby, you don't really have to like consider it, but really the baby is forming according to the mother's emotional world, whether she's aware of it or not. And so I know that you and I, went to some oppas together, and we have that connection in our being together.
Right.
Totally. But, I know you are one of the other people that talks, one of the few other people that people call to sort of debrief around birth.
Yeah, they do.
If you could give 1, 2, 3, or 3 pieces of advice, what would that be?
Nutrition is the foundation of a healthy pregnancy. On a physical level. Humility is one of the most important tools in your bag. And work on developing your relationship with the baby as well as the mother during pregnancy, because quite a few times in labor with a questionable situation, I would just intuitively say to the baby, you got to show me that everything's okay here or not. You got to get me some definitive sign. And heart tones would normalize or whatever. And so there's more, but those three things I think are really, really important.
Yeah. Great. So I'm going to bring this to a close, but I want to just say, so when people say they meet you and they tell me about it, they're always saying to me, boy, I just thought she was so much taller than that. Do you hear people say that to you?
I have been told that in the past, that people who talk to me on the phone will say, you sounded so much taller on the phone. It's interesting. I guess I sound like I have maybe, I don't know, a big personality, a big mouth. I don't know, that I would be, it would be accompanied in a bigger package or something.
Well, how tall are you? I mean, I happen to know Anne, and she's a short people. But
I am 4'11.5" tall.
And when you're standing fully straight up.
Yes.
And then one last fun piece, which I should know this, but what is your favorite type of food? Because Anne and I, when we're together, go out to eat. So
my favorite type of food, well, I would say for savory food, it would be seafood. And for sweet food, it would be chocolate.
For sure. For sure. I will keep that in mind for the next trip. But usually, I don't like chocolate, but I do like seafood. So, yeah.
And for wine, it would be that Sauvignon Blanc we had in Toronto at the ice.
That was good, and you've got the name of it, don't you?
I do. I know which one it was.
Yeah, you need to send me the.
Well, I'll tell our listeners, it was Mapmaker Sauvignon Blanc from New Zealand, 2016 vintage, and it was amazing.
It was, right. It was really good. It was really good. Well, thank you for that extra little caveat there, Anne. So thank you so much for joining me, and everyone, for more podcasts, video clips, and my webinar series, which is Beyond the Basics, Resuscitation of the Newborn, go into much more detail than in the class. Visit KarenStrange.com/webinars.
And if you want to know about my books, you can go to Midwifery Books. Midwifery Books, that's books plural at .com. And if you haven't taken your class, if you haven't taken Karen's class, you're really missing something. You should take it immediately.
Thank you. And then I do want to say, if you have any questions, we're doing, I've started doing a frequently asked Friday where it's up, you know, you can watch them, you can see them. I answer like 4 questions. So if you have a burning desire, a burning question, anything you want to ask, I want to be able to answer it. So you can submit it on my website or go to Facebook, or just write me an email at info@karenstrange.com. Anyway, Anne, thank you. And we should do this again. This was fun.
Yeah, it was great.
It was great.
Thanks for having me.
You're welcome. Thank you, Anne.